Assalamualaikum warahmatullahi wabarakatuh. We are from Group 12 who like to present about anxiety disorder for our BIO310 video presentation. Before I start the presentation further, allow me to introduce my group member which is Hidayah, Fitrah, SHAHIRA and HUSNA.
So this is our context for this video presentation. Anxiety is a feeling of unease such as worry or fear that can be mild or severe. Everyone has feeling of anxiety at some point in their life. For example, I give you may feel worried and anxious about sitting an examination or having a medical test or a job interview. The symptoms of anxiety disorder are having heart palpitation, dizziness, having trouble to sleep, and feeling restless. For our objective, to know the range of age in anxiety patients among the respondents, to find the most common symptoms of anxiety, to find the best prevention of anxiety, and to find the best treatment for the anxiety disorder. For the problem statement, to get a better understanding about the problem of anxiety and how it will affect on people's daily life, and to know the percentage of our respondents who suffer from this anxiety disorder.
Next, for the methodology part of our video presentation, we will conduct a survey related to our topic which is anxiety disorder. We focus on our respondent among UN TAPA students and others, and the minimum number of respondents that we require to have is 30 respondents. This survey will be conducted online and the question will be answered in Google Form as our survey platform. Here, I also attach on the slide the link for the Google Form for our respondent to answer when it is shared online through social media such as Telegram and WhatsApp. Then, this is the questionnaire that we have agreed to put on the Google Form that will be answered by our respondent. Basically, the content of the question included the background of respondent, symptom, causes, the diagnosis from doctors, prevention and treatment medication are natural. After the survey, we had to analyze the answer from our respondent for our questionnaire to obtain the result. All the data based on symptom, causes, diagnosis from doctors, prevention and treatment will be summarized in this part and the data will be presented in the table and graph. In the background of respondent, the majority of respondents that answer this survey come from female than male respondents in the gender category. Most of them are students and employees. In the earlier question, we asked our respondents about the idea of anxiety disorder and most of them already know about it. But just a few of them are still not aware of this disorder. The age of our respondents come in the range of 15 to 34 years old, and most of the respondents that answer this survey come from the average of 19 to 22 years old. In this survey, we also successfully achieved the number required for this survey, which is 44 respondents. Most of them agree that causes of anxiety come from social media, environment, and also come from phobia and trauma. From the result obtained for the symptoms through the survey in general, they thought that symptoms of anxiety disorder can be identified by nervousness, panic, and sweating. When being asked about the symptoms of fear or being overwhelmed and nervous until it is difficult to relax, most of the respondents answered that they sometimes have this symptom and few of them had it often when they start getting anxiety attacks. Furthermore, we also conducted our survey about anxiety among respondents. 30 of them had chosen sometime, 6 respondents choose often, and 8 of them select none for the option. For those who had an anxiety disorder, time taken for anxiety to attack them was mostly 5 to 10 minutes only, and 7 people choose that it happened for 10 to 20 minutes, but a few of the respondents had above than 30 minutes. We also asked about the diagnosis from the doctor about their stage disorder. 50 of them were in the mild stage, 12 is moderate, 7 were in panic level, and 4 respondents were in the severe stage. Besides that, the causes that triggered their anxiety had to be known from the survey, which mostly come from the environment and phobia. It also is known that it comes from social media and heredity. To prevent this disorder, most of them answer it can be reduced by going to explore nature and correctly handling stress management. They also agree that living in healthy life can help them to reduce anxiety, but a few of them also choose by taking a medicine that can help them to control the anxiety disorder. Next, the results show that 24 respondents choose yes and that anxiety gives a more negative impact rather than positive. For seeking the treatment, 40 respondents answered not to it, just 4 of them agree to seek the treatment if given a chance. On the other hand, they prefer to treat their anxiety through therapy, when 90 of them choose that option. Meanwhile, 17 to counseling, 6 to medication, and 2 by facing their trauma.
Next, I will present about discussion. According to data obtained, 13.6% of our respondents often get anxiety, 68.2% sometimes get anxiety, while the rest do not experience it. Symptoms of anxiety. So what are the symptoms of an anxiety disorder? General symptoms of anxiety disorder include physical symptoms and mental symptoms. For physical symptoms, such as cold or sweaty hand, heart palpitation, and shortness of breath, while mental symptoms, feeling panic and nightmare. So based on our survey, 79.5% of the respondents get all of the symptoms of anxiety, such as rapid heartbeat, sweating, panic, and nervousness. So what causes of anxiety disorder? Anxiety disorder are like other forms of mental illness. They do not come from personal weakness, character flaw, or problem with upbringing. But researchers do not know exactly what causes anxiety disorder. So they suspect a combination of factors that play a role. So based on our survey, 68.2% of the respondents choose environmental factor. So the example of the environmental factors, such as experiencing a trauma that might trigger an anxiety disorder, especially in someone who has inherited a higher risk to start. Next, can anxiety disorder be prevented? No, we cannot prevent anxiety disorder, but we can take steps to control or reduce the symptoms by check out medication, by talk to a healthcare provider or pharmacy before taking over-the-counter medication or herbal remedies. This is because some of these contain chemical that may make anxiety symptoms become more worse. And also explore stress management, live a healthy life by exercising regularly, and eat a healthy and also balanced diet, and also overcome it by force. So based on the survey, 22.7% of the respondents choose live a healthy life, 31.8% choose explore stress management, and 36.4% choose all above the prevention.
Next, I will continue to explain about diagnosis of anxiety. If you experience any symptom of an anxiety disorder, see your doctor or a mental health specialist such as psychiatrist or psychologist. To diagnose an anxiety disorder, a doctor performs a physical exam, asks about your symptom, and recommend a blood test, which help the doctor determine if another condition such as hypothyroidism may be causing your symptom. The doctor may also ask about any medication you are taking. Certain medication may cause symptoms of anxiety, such as levodopa, a medication used to manage Parkinson's disease. If doctor does not find an underlying cause of the symptom, he performs a psychological evaluation. During a psychological evaluation, a specialist asks if you have a family history of an anxiety disorder or depression. He asks about your symptoms, when they started, how long they have lasted, how severe they are, whether they have occurred before, and if so, how they were treated. In addition, he may ask you to complete a questionnaire which asks about the way your symptoms affect your life. Other psychological conditions, including post-traumatic stress disorder and eating disorder, may accompany anxiety disorder. For this reason, the specialist also asks questions that allow him to evaluate whether another psychological condition could be affecting you. After the specialist assesses your symptom and family history, he conducts a feedback session during which you and the doctor discuss the diagnosis and most appropriate treatment option. Next, treatment for anxiety. Based on the survey, only 4.5% of respondents get their treatment while the rest are not. Besides, 43.2% of respondents believe that therapy is better and safe to treat this disorder. Psychiatrists and psychologists may offer therapy to manage anxiety disorder in adults. Therapy is designed to help change in behavior that lead to negative emotion with the goal of improving quality of life. Cognitive behavioral therapy is often used to treat people with anxiety disorder. There are two aspects to this type of therapy: the cognitive component, which helps to change how a person views a situation, and the behavioral component, which helps to change how a person reacts to a situation. Last but not least, conclusion. There are 4 parts, which is the survey, cause, symptom, and treatment. So the first one is survey. 44 people have involved. 30.6% of respondents often get anxiety, and 68.2% sometimes get anxiety. Next is cause. Most respondents answer environmental factor as mainly cause of anxiety, and the symptoms are rapid heart rate, sweating, panic, and nervousness. Lastly, treatment. Most respondent answer is therapy.
Next, this is the 7 reference that we have obtained for our video presentation.